Hello everyone, welcome to the LUMP Special Lecture Series featuring tongue diagnosis, first lecture of 4. Today we're going to talk about the topography of the tongue body color, and we will be showing you tongue images towards the end of the session. Of the diagnostics used in traditional Chinese medicine, the method of tongue diagnosis plays an important part in diagnosis by looking. Nevertheless, tongue diagnosis must be analyzed in context with all the 5 diagnostic methods: diagnosis by looking, diagnosis by hearing and smelling, by asking, and by feeling. In daily practice, tongue diagnosis can complete the findings of an examination, as well as contradict them. The reason for this may be that in most cases, the tongue usually shows the fundamental state of a person, but the causes of illness can differ from this fundamental state, and thus the tongue appears to be inconsistent. For example, cervical pain can be caused by external wind cold, whereas the patient shows heat signs and the tongue is red and dry. This shows that tongue diagnosis may complete diagnosis by asking, but cannot replace it. The tongue is divided into the 4 parts: the tip of the tongue, the center, the root, and the sides. The tip of the tongue represents the heart. The lungs are represented slightly behind the tip. The center of the tongue represents the stomach and spleen. Root of the tongue represents kidneys, bladder, large intestine, and small intestine. Liver and gallbladder belong to the lower burner. Remember this if there is slippery coat at the root of the tongue. The sides of the tongue represent liver and gallbladder. Theoretically, gallbladder is represented on the right side and liver on the left side. Because liver and gallbladder are closely related, this differentiation is more of a theoretical nature. The normal tongue. Body color of the normal tongue is pale red. The tongue body is neither too thick nor too thin. The normal coating is thin, white, and the body color should be seen through the coating. It is important to be completely familiar with the normal tongue so that changes are easily observed. While it is easy to see obvious changes, it is difficult to observe the slight ones. There are many food, beverages, and sweets which change the color of the tongue and lead to misinterpretation. This is the reason why the patient should have refrained from eating and drinking for at least 1 hour before the tongue is examined. Additionally, proper lighting is necessary. The best light is natural daylight. The tongue should be examined as close to a window as possible. If artificial lighting is necessary, halogen lighting should be used. The patient is asked to stick out his tongue as far as possible without using force. If the patient doesn't extend his tongue enough, it will appear to be swollen. Similarly, if he uses too much force when sticking out his tongue, it will become narrower and reddened by the effort. The patient should extend his tongue for no longer than 20 seconds. Less is better. If the patient extends his tongue too long, the tongue body will redden. In general, it is wise to extend the tongue for only a short time and then repeat the process. The therapist must examine the following areas: tongue body color, to give us the general impression and localization, moisture of the tongue coating, which includes thickness, color, localization, the tongue body, the size, the thickness, the cracks, and the points. We observe the color, and we note localization. Strengths of tongue diagnosis. The tongue gives the true picture roughly 98% of the time. For example, yin or yang deficiency, hot or cold. The progress or lack of progress of the disease can be monitored. For example, a purple body color is expected to become less purple. A tongue without coating is expected to develop a coating, and a thick coating is expected to become thinner. It is easier than pulse diagnosis. It is also more objective. What are the limitations of tongue diagnosis? The tongue does not always reflect all aspects of a condition. For example, in liver blood deficiency with liver qi stagnation, the tongue will often reflect liver blood deficiency but not liver qi stagnation. Do not expect the tongue to reflect all the aspects of a pathology. There is a lack of detail. For example, a thick, sticky yellow coating on the root shows damp heat in the lower burner, but not its exact location. Let's now proceed to tongue body color. The body color of the tongue mirrors the state of qi and blood, of yin and yang. To make an accurate diagnosis, several tongue signs are needed. For example, a pale body color of the tongue points to qi deficiency as well as to blood deficiency. Only when the moisture of the tongue is examined can an accurate diagnosis be made. A dry and pale tongue body points to blood deficiency, whereas a wet and pale tongue body points to qi deficiency. In this lecture, pale, red, and bluish tongue body colors are discussed, as well as the meaning of the localization of the body color. A pale tongue body color is lighter than the normal tongue. The paleness varies between light and clear. The paler the color, the bigger is the disorder. The pale color indicates a condition of deficiency. Depending on the nature, it is either blood deficiency or qi or yang deficiency. The pale color alone is not sufficient to decide between qi and blood deficiency. Additionally, the moisture of the tongue body is needed. The pale tongue is divided into the pale dry and the pale wet tongue body. The pale and dry tongue body points to blood deficiency. If the blood doesn't reach the tongue gets pale. Because the blood also moistens the tongue, it gets dry. Therefore, a pale and dry tongue refers to blood deficiency. Typically, the tongue body is thin. If a pale and dry tongue has a thick tongue body, the thickness of the tongue body points to dampness. The pale and wet tongue body points to qi deficiency. If qi doesn't reach the tongue gets pale, just as with blood deficiency. With qi deficiency, the transformation of the body fluids is restricted. So, dampness occurs and the tongue gets wet. Accordingly, a pale and wet tongue points to qi deficiency. If the tongue is extreme pale and wet, there is yang deficiency. In this case, signs of cold must exist. Typically, the tongue is thick. If a pale and wet tongue has a thin tongue body, the thin body points to blood deficiency. By a red tongue body color, the color is redder than the normal tongue. The reddening varies between light red and dark red. The red tongue body indicates a condition of heat. The redder the tongue body is, the higher the heat. This heat can be deficient heat caused by yin deficiency or excess heat. This excess heat can be caused internally or externally by the pathogenic factor heat, for example, with an infection. The red tongue body is divided into the red and dry, the red and wet, and the red without coating tongue body. The red tongue body points to heat. If the tongue body is dry as well, this is a sign of yin deficiency. A red and dry tongue body points to heat in combination with yin deficiency. Either the heat is caused by yin deficiency or the yin deficiency is caused by heat, because heat burns the body fluids. The red tongue body points to heat. If the tongue body is wet, this is a sign of qi deficiency, yang deficiency, and dampness. The wetter the tongue is, the more dampness exists. A red and wet tongue body points to heat in combination with dampness. Heat reddens the tongue body. If the tongue body is also wet, the transformation of the body fluids must be damaged. Two mechanisms can be the cause of this. Liver fire and spleen yang deficiency can be present at the same time. Liver fire reddens the margins of the tongue, and spleen yang deficiency leads to dampness and turns the tongue wet. With heat, there is the danger of dryness. The organism can produce dampness as a wrong compensation of the dryness. The red tongue body without coating can be seen as an increase of the red and dry tongue body. The tongue body has no coating at all, and it can shine like a mirror. The red tongue body points to heat. If the tongue body is without coating, this is a sign of yin deficiency. A red tongue body without coat points to heat in combination with yin deficiency. A red tongue with coat is often analyzed as excess heat. This can be right, but daily practice shows that the coating isn't a reliable sign to decide whether heat is excess or deficient heat. Deficient heat as consequence of yin deficiency is possible as well. Now you can see here a comparison between a tongue with red tongue body without coat and a red tongue body with coat. The red tongue body without coat is yin deficiency with empty heat, while red tongue body with coat is a classic example of excess heat. A bluish color of the tongue body points to blood stagnation. If the tongue body is pale bluish, blood stagnation is caused by yang deficiency or cold. If the tongue body is red bluish, blood stagnation is caused by heat. This is heat in the blood. The meaning of the localization of the tongue body color should be explained exemplarily by the red tongue body. In principle, it should be acted as follows. Assign the colored area to the Zhangfu. Assign a Chinese diagnosis to the color. Combine the color with the area. Example, red tip of the tongue. The red color points to heat. The affected area, the tip of the tongue, corresponds to the heart. It can be concluded that this sign refers to heart fire. The red tip of the tongue points to heart fire. The cause of heart fire can be heart yin deficiency. Red sides of the tongue point to hyperactive liver yang or liver fire. A red center points to stomach fire. A red root of the tongue points to kidney yin deficiency. Because kidney yin deficiency usually leads to yin deficiency of other organs, kidney yin deficiency alone is rarely seen. Now let's go to tongue images. The first case is that of a female, 62 years old. As you can see, the color of the tongue body is reddened, and this means there's heat. And then the reddened tip of the tongue means there is heart fire. Now let's look at the tongue body. As you can see, it's slightly swollen, so it could be spleen yang deficiency or dampness. Then you could see a cleft or the divided tip of the tongue, which means heart blood deficiency. Then you could find some tooth marks. It means spleen qi deficiency. Tongue coating. There is no coating at the middle third or the second third of the tongue. So that means we have stomach yin deficiency. Now let's take a look at the cracks and spots. You will notice a vertical crack extending up to the area of the lungs. So this would be stomach yin deficiency and lung yin deficiency. The tooth marks and the swelling of the tongue are signs of dampness and spleen yang deficiency. The vertical crack and the lack of coating in the middle third are signs of yin deficiency. Dampness could be used to compensate yin deficiency. The reddened tip of the tongue and the crack in it are signs of heart blood deficiency and heart fire. The yin of the heart, the lungs, and the stomach has to be tonified. Dampness has to be dispelled and the yang of the spleen tonified. Now let's go to the second case. Male, 37 years old. You have a bluish tongue body. This means blood stagnation. Although this looks like very purple to me. Okay, when you look at the tongue body, it's large. So a large tongue actually means there's a lot of heat. And Swollen sides means stagnation of liver qi. Now let's look at the tongue coating. Okay, it's thick, yellowish at the root. So this is actually phlegm heat in the lower burner. Phlegm is the thickness, yellowish is the heat. Now, you will notice a crack at the tip of the tongue. This represents heart-yin deficiency. Bluish color of the tongue means there is blood stagnation. In conjunction with the swollen sides, blood stagnation can be caused by liver qi stagnation. The thick yellowish coating at the posterior third means there is phlegm and heat. Heart-yin deficiency is the basic problem of heat signs of this patient. So treatment principle would involve moving the blood and dispelling the phlegm and heat. If heart-yin deficiency plays an essential part, this will worsen symptoms. In this case, the yin of the heart has to be tonified. Let's proceed to case number 3. Female, 34 years old. The color of the tongue body is pale and rather dry, so this means blood deficiency. The tongue body is swollen, translates to spleen-yang deficiency, dampness. Tooth marks, spleen-qi deficiency, and also dampness. The thin white coating is normal, so it's not very significant here. Notice the red spots at the tip of the tongue. This is heart fire. There are also few red spots on the pale sides. Liver blood deficiency. The slight crack in the area of the lungs, that's the front third, there is beginning of lung yin deficiency. This tongue shows signs of blood and yin deficiency plus dampness and yang deficiency. Either there is causal weakness of yin and yang, or dampness is necessary to compensate the yin deficiency. Spleen yang should be tonified and the dampness expelled. And the heart should be cooled and the spirit or the shen should be calmed. Depending on development, the treatment principle must be changed. With time, either signs of yin deficiency or of yang deficiency can predominate. Let's proceed to case number 4. The color of the tongue body is pale bluish, particularly at the middle. So this is blood stagnation caused by yang deficiency or cold. If you look at the sides, it's red bluish. So this is liver blood stagnation caused by heat, or there is heat in the blood. Tongue body, swollen, red bluish sides, which is very, very indicative of liver blood stagnation, and then a slightly deviated tongue. If you notice, the tongue is slightly pointing or deviated towards the left. This is wind. The tongue has no coating, and this is noted especially at the sides. So this is telling us there is liver yin deficiency. Okay. No coating, that's yin deficiency. Location, liver area. And again, you could see a vertical crack almost extending up to the tip of the tongue. Stomach yin deficiency, lung yin deficiency, heart yin deficiency. This tongue shows significant blood stagnation. Therefore, blood has to be moved. You have to invigorate the blood. The sides of the tongue are red-bluish, which indicates that liver blood stagnation is caused by heat, and there is heat in the blood. The middle of the tongue is pale bluish. This indicates blood stagnation caused by cold or yang deficiency. The presence of a vertical crack, tells us that there is yin deficiency. If you remember, it's located almost, it's extending up to the tip, almost to the tip. So that's yin deficiency of the stomach, the lungs, and the heart. So treatment, you have to move the blood and tonify the yin. The pale bluish tongue body indicates blood stagnation caused by cold or yang deficiency. Now let's go to case number 5. Female, 43 years old. The tongue body is pale and rather dry, so this is clearly blood deficiency. The tongue body is swollen, so this is very spleen yang deficiency and dampness. The tongue has a thick whitish coating. Thick means phlegm, whitish, cold. So it's phlegm cold. There are slight cracks at the sides. So that's liver blood deficiency. Dispelling cold phlegm has to be given priority treatment, and this should be supported by tonifying the spleen yang. Complications can arise with time through liver blood deficiency. In this case, liver blood has to be tonified or nourished. Thank you very much for your attention.